Hello, everyone. I do apologize that the original recording was lost. When I went to change it to the MP4, it became corrupt, and so it had to be deleted. Um, so I will go through the original final review. Afterwards, I will give you a couple bonus things about the exam. And again, I do apologize for the delay in the recording. Um, I wanted to make sure I had all of the information and the exam was completely finished, which it is. And I wanted to get your HESI scores up. It is currently 1950, and I am at school because I wanted to get this finished for you this evening, and I do apologize for the delay. With that all being said, here is your final exam review. The final exam will be 100 questions. For the majority of you, it will be December 14th at 12:15 in Sykes 24, which is Kettner Auditorium. If you have SAS accommodations, the SAS department will determine where you are going. As of right now, I do not have that information solidified. I have an idea, but I will find that out 100% on Monday um, for my SAS students. And that's not me. That's coming from them not giving me where everyone is going. Okay. Again, the final exam will be 100 questions. When you're looking at fluid and electrolytes will have, hang on, and ABGs, there will be 8 total questions on fluid and electrolytes and arterial blood gases. You want to make sure that you know how differences in electrolytes affect your heart rhythm, such as hypokalemia, hyperkalemia. You want to make sure that you understand patients with hyponatremia can become confused. They can you have to assess their airway. These are things you want to make sure that you are aware of. Again, for fluid and electrolytes and arterial blood gases, there will be a total of 8 questions. And here I just added some slides in to kind of help you to recall your normal values, and hopefully that will be of assistance to you. Again, with your ABGs, it is included in part of the 8 questions with fluid and electrolytes. You need to make sure you know how to interpret them. You need to know their causes, whether or not it is compensated or uncompensated, and be able to identify those, identify disease processes which can affect your arterial blood gases. Tracheostomy patients, for patients with a tracheostomy, whether it's from a thyroid or from, thyroid surgery or not, make sure you look over how to care for those. Make sure you understand the complications of thyroid. Sorry. Oops. Having some trouble here. There we go. Make sure that you look at postoperative care for patients with a tracheostomy. Make sure that you look at complications of a tracheostomy, such as pneumothorax, bleeding, infection, subcutaneous emphysema. Here is your basic A&P and pathophysiology of the heart. Make sure that you're familiar with those. Here you have your EKG breakdown for your paper. Make sure you understand how to look at ECG paper. Here's another example of paper. Here are some of the things that you need to look at as far as heart failure goes. When you're looking at your patients with heart failure, you need to make sure not only do you understand your core measures, make sure that you understand the difference between right-sided heart failure and left-sided heart failure. Make sure that you understand when a patient needs anticoagulant therapy. There are 19 total questions on cardiac, whether it be about chronic angina, ECG interpretation, heart failure, all of those, including your vascular system with hypertension and deep vein thrombosis is a total of 19 questions. Again, that's all of your cardiac stuff, including your ECGs, your heart failure, and a few questions on hypertension and any type of vascular issues. Okay? That's 19 total questions. Again, make sure you know the difference between left-sided and right-sided heart failure. Make sure you know what BNP stands for. BNP. Remember that if it goes up, it's a sign of worsening heart failure. Again, if the BNP is going up, it is a sign of worsening heart failure. Excuse me. Look at your medications for heart failure. Make sure you're looking at your diuretics. Make sure you're looking at your nitrates. Make sure when you look at hypertension, make sure you're looking at what is considered essential hypertension, what is considered secondary hypertension. Again, make sure you understand what essential or primary, that is the most common cause of hypertension. Remember, essential hypertension is hypertension without an underlying disease process. Now, underlying disease process is not the same thing as risk factors, okay? Essential hypertension is when you have hypertension with unknown disease process. That does not mean you do not have risk factors for hypertension. It means you just do not have a disease process. Okay. Here we have some more information about hypertension that's very important. Here's your diuretics. Again, it's a look at your medications. If I'm scanning through it, it's probably not all that important. If I'm stopping, it's probably more important. Make sure that you look at venous thrombosis, DVTs, how to prevent them in the hospital using, like, if you're in the hospital, you may have SCD hose on. But remember, early ambulation is your best defense against a deep vein thrombosis. Again, early ambulation is your best defense against a deep vein thrombosis. Make sure you understand the difference between heparin and low molecular weight heparins. Look at your, moving on towards diabetes. With diabetes, we have a total of, hang on. I wrote it down. Diabetes, you have a total of somewhere in the neighborhood of 11 to 15 questions. Now remember, some of those may be related to your ABGs. Some of those may be related to, it may be a patient who is stable with their diabetes, but now they've come in because they have emphysema and they're being started on steroids, and this can, mess with their blood sugar. It can cause it to go up. So just because I'm saying it's a diabetes question doesn't mean it can't also be a pulmonary question. Again, there's a range between about 11 and 15 of those questions on the exam. You have a few thyroid questions as well. Here's your thyroid. Make sure you understand the differences with the distress after a thyroidectomy. Make sure that you understand that they will always need to be on medication. If they have had a thyroidectomy, know the difference between hypo and hyper. Neuro. When you look at your neuro stuff, when you look at the difference between a stroke and a TIA, make sure you understand the types of strokes and their locations. Make sure that when you're looking at your stroke information, you know what type of damage you would see if someone has a right hemisphere stroke. What type of stuff goes on with a left hemisphere stroke? What are those patients going to look like? What kind of deficits are they going to have? How do we help with these patients? How do we deal with expressive aphasia? How do we deal with their depression? What is the difference between a TIA and a stroke? Remember, a TIA, all the symptoms resolve. Strokes are more chronic. You want to make sure that you're getting them to a certified stroke center as quickly as possible. Make sure you look at your core measures with your strokes. Strokes in general have between 5 and 7 questions. The rest of your neuro, which is Parkinson's seizures, MS, ALS, all of those, is about 5 to 6 questions as well. When you're looking at Parkinson's disease, remember it is a progressive chronic disease. Remember, know about levodopa and cardopa, how they work, how they help with the dopamine. Make sure that you understand that. Make sure that you understand Parkinson's psychoses. All of that's very, very important. Make sure that you understand about multiple sclerosis, that it starts out as relapsing, remitting multiple sclerosis most of the time. Make sure that you understand that medications will decrease symptoms, but it won't keep them from ever having another exacerbation of their multiple sclerosis. Okay? Oops, sorry. When you look at seizures, again, that's part of those questions I've already talked about with your neuro and your Parkinson's. Make sure you understand your medications. If I took the time to write down a medication, you probably need to know it. That's all I'm saying. Make sure you understand the different types of seizures. Understand safety with seizures. Remember, we no longer put a bite block in. Make sure you understand about your phenytoin. Make sure you understand about with their brushing their teeth. Make sure that they understand about what the different that you have to make sure that they're taking. With phenytoin, you have to make sure that you're keeping your drug levels up correctly. You have to make sure that they are taking their medication at the same time, and all of those things. So make sure you're familiar with that medication. Again, if I take the time to write down a medication, it is extremely important that you learn it. As far as diabetes goes, know your insulins, know your oral diabetic agents. Know your big guns. I'm not saying know every last one, but know your different types of insulin. Know your metformins, your glycerides, things like that. Again, if I took the time to say it, probably need to know it. So different types of insulins, your glycerides, your metformins, things like that. At least know the standards, okay? Tuberculosis is part of those pulmonary questions. With pulmonary questions, you have your COPD, TB, other pulmonary questions, including chest tubes. There's between 8 and 10 questions with these. Make sure you understand tuberculosis care in the hospital, out of the hospital, in the community. Make sure that med-adherence is the best way to take their medications, that they sometimes have to go to a tuberculosis clinics. Know rifampin. Again, if I take the time to write it down, probably important to know. Okay? Sickle cell. You know how I love a yellow box. You know how I love an action alert. Make sure you understand the treatment of it. Make sure that you understand it's all about perfusion. It's the perfusion problems that causes their pain. What happens with the sickled cells? Do they stay sickled? Do they become do they go back to their normal shape? They do, but they're never quite as strong as they used to be. Okay, that's the reason a lot of times these patients need transfusions. So make sure you look at your sickle cells, look at your other anemias, but make sure you're definitely looking at blood transfusions. Make sure you look at the how to give blood. What is signs of a blood reaction? Things like that. Pulmonary, we've already gone over a little bit of it. I've already told you how many questions. With pulmonary, make sure that you look at your diaphragmatic breathing, your pursed lip breathing, use of oxygen, steroids and blood sugars. Said it again. Pneumonias. Who is at risk for aspiration pneumonia? Okay, think about that. Make sure you're looking at all of those different things. Is there anything else we need to add with that? No. Okay. This is just some good, healthy facts that go through. You're familiar with these. They're from your PowerPoints. They're nothing exciting. I just kind of put a couple in here so that you could look at them. Orthopedics. There are, hang on, one moment please, between 8 and 10 questions on orthopedics. Know your traction types. Know your knee replacements, hip replacements. Remember, when you're looking at a hip, when we talk about arthroplasty and the hip replacement, it can be because of wear and tear, or it can be because there was a what's it called? A fracture. So when someone fractures their femoral head, that is a hip fracture. Okay? If someone fractures the ball of their femur or their femoral head, that is considered a hip fracture. Make sure you look at compartment syndrome. Make sure that you look at, this is one of the questions that we had some issues with on exam 3. That's the only time I'm saying the word exam 3. look at 3-point crutch walking. Remember that you want no pressure to the armpits. It can cause nerve damage. Know your differences between osteoarthritis and rheumatoid arthritis. Remember, rheumatoid arthritis is morning stiffness. Remember, it also is more symmetrical. Osteoarthritis is wear and tear. You see it more in their big joints first. It can be one-sided. Remember, with the RA, the joints can become soft and smushy, and they can have more inflammation. Remember, the inflammation in osteoarthritis is generally just due to the inflammatory process due to the pain. But rheumatoid is an inflammatory disease. Okay, remember that RA is an autoimmune disease as well. Renal, look at your chronic kidney disease. Make sure you understand your dialysis types. Feel your thrills, hear your Bruits. Look at your polycystic or kidney disease. What about their sodium levels? Make sure with polycystic kidney disease, you look at their sodium levels. Make sure that you're looking at who gets what, okay? Make sure that you take time to look at polycystic kidney disease, chronic kidney disease. Big thing with chronic kidney disease is your different types of dialysis. Who's going to get what kind of dialysis? How do we know what is dialyzed out? Okay, what is dialyzed out? Meaning it's your impurities. So if someone's kidneys aren't working, their potassium levels may be high when it's the day for dialysis, but once they go to dialysis, they become back down to normal. Remember, it doesn't help with anemia, but sometimes people who are having hemodialysis especially will get blood transfusions during dialysis, okay? Liver, hepatic. Know thy types of hepatitis. Know your chronic cirrhosis, your alcohol-induced cirrhosis. Know your treatments. Know about ammonia levels. Know about lactulose, making sure that they've got to have X number of bowel movements a day to make sure that they are being able to stay more cognizant and keeping those ammonia levels down. Know why people with cirrhosis of the liver are at a bleeding risk. It's because of that portal hypertension. That is what causes the esophageal varices. It's that making those vessels bigger, okay? GI, colostomies, hernias, Crohn's, and ulcerative colitis. There's a total of 6 to 8 GI questions. With colostomies, know where the colostomy is, where the poop what the bowel movement's going to look like. Sorry, guys, it's 8 o'clock at night. Did not mean to say the word poop. Not re-recording it. Hernias, know about how to wear a truss. With look at your Crohn's disease again. Look at your ulcerative colitis. Let me see if there's anything else I want to say about this. Nope. Okay. Let's see what else. Really, as far as you need to make sure you're looking at your cancers. I did, again, the review I did for exam 4 is very nice. There are 7 to 10 cancer questions. There are 7 to 10 priority and math questions. I sent you out a example of math questions today. It would behoove you, oops, dropped my pencil. It would behoove you to know how to do the math questions that I set out to you. I sent them in 2 different papers so that you have the questions on one and the answers are on another, so you can't cheat and look at them unless you want to. That way you have both. Let's see. Talked about that. Talked about how many thyroid questions there were. I think that's it. Okay. There are 100 questions. Only 99 of them are difficult. At least there's one. The last question is a very simple question. It's what's the best way to prevent infection? It is wash your hands. It is not pick your nose. Okay. Let's see what else. I told you where the different questions were. That hopefully will help you some. There is 6 to 8. I think no. 5 to 6. Let me double look. I want to say it's 5 to 6. Hang on. One moment, please. Okay. There are between 6 and 8. Select all that applies. Okay. Between 6 and 8. Select all that applies. They're either about a medication or about a procedure that you need to make sure that you, or a task that you need to be able to make sure you understand, like a blood transfusion. But anyway, there are between 6 and 8. Select all that applies. I told you how many math and priority questions were between, I guess 6 and 8 is a good number to call it. I hope this was helpful. I do apologize for the delay and that we had to re-record it. I will put this up tonight, and I will be around on Monday. If you have any questions, please don't hesitate to reach out to me. Thank you.